Minister for Health and Social Development, Honorable Ronnie Skelton, visited People's Hospital on Wednesday morning to meet and greet the staff. During the visit, Minister Skelton spoke about what government's plans are for the People's Hospital once the new hospital is commissioned, and assured that no patients will be refused care at the hospital under his watch. Walter Barrett has more on the minister's visit.
Minister for Health and Social Development, Honorable Ronnie Skelton, continued to tour the territory's health facilities on Thursday morning, this time with a meet and greet at the People's Hospital, where he met with staff and administration there. The minister was accompanied by Carolyn Stout-Igwe, Deputy Secretary in the Ministry of Health, and was guided along the tour by Pat Malone-Smith, Director of Hospital Services. Minister Skelton visited each of the hospital's wards, stopping to speak with staff and administration while hearing some of their concerns and hopes going into the future as it pertains to the everyday running of the hospital. The health minister was also briefed on some of the changes that were made to the hospital within the last 4 years and had his own questions answered by the hospital services director. JTV News spoke with Honorable Skelton about the plans for the People's Hospital once the new hospital comes on stream. According to the minister, the hospital will still facilitate outpatients and access will be gained to the new hospital via People's.
Our intention was to use the old hospital as outpatient services. In our plan, the emergency room was supposed to remain where it is, and the tunnel, the corridor, 8-foot corridor was supposed to go straight through the wall in the back, and that will be connected by elevators and staircase to the access to the hospital. So if this had remained where it was, then that was the process, and it will still be used for that, for not that purpose, but for the outpatient care people to access the hospital without having to walk out in the rain and into the atmosphere. So that's the main connection between the old hospital and the new hospital. That's what that will be used for. On the second level, there's also a connection where you go out and you walk under a covered canopy and you access the lobby of the new hospital. So there was a comprehensive plan done for incorporating all of these things into the healthcare system.
Minister Skelton further explained that the plan for the new hospital when the contract was let around 2006 was that it would have the capacity to house 128 beds on 3 levels. The minister said that these numbers will not go down.
I think if it's not that, it will be a 128-bed hospital. We cannot afford to build anything less because here we have over 80-something beds, and they're full. Yes, there are arguments that some of the people in the beds don't need to be here, but I think that's a social development issue that my government, the government that I'm a part of, will have to address, because you can't just throw people out on the street, and I wouldn't be part of that exercise.
Minister Skelton was also able to tour the new People's Hospital last week, where he was given an updated briefing on the status of the 7-story building that will house 3 operating theaters, 1 surgical ward, a hydrotherapy pool, and other things. According to Minister Skelton, the scheduled date for the completion of the new hospital is just over 1 year.
Because it's a new property, you got to work out the kinks.
Yeah.
So we don't want to, when you're dealing with life, you don't want to move too quickly to put it fully into operation. So it's going to be phased over a period of time. Okay. So that's the way I see it right now. But from here till finishing, once we say let's go with the contract that was signed recently, I have a time frame of 15 months.
Minister Skelton visited with participants of the Road Town Seniors Program at the new Social Development Building on Monday, November 14th, as part of a series of tours that took place last week as the health minister met with and received progress reports from various officers and departments within the Ministry of Health and Social Development. This is Walter Barrett for JTV News.